Good day, everyone. We are Janine, Eunice, and Joanna, and welcome to our capstone project presentation. Our project is titled Improving Hand Hygiene Compliance Among Personal Support Workers in Mackenzie Health Long Term Care, a Quality Improvement Initiative. Let's start.
In summary, we selected this topic because hand hygiene remains one of the most effective ways to prevent healthcare associated infections. Residents in long term care are especially vulnerable because they are older adults with chronic illness, weakened immune systems, and frequent contact healthcare workers. This is an important Canadian quality and patient safety issues because improving hand hygiene helps reduce infection, prevent hospital admissions, lower healthcare costs, and support infection prevention standards established by Public Health Ontario and the Public Health Agencies of Canada. As nurse leaders, our role is to promote evidence-based practice, educate staff, monitor quality indicators, support compliancy, and foster a culture of patient safety. During the plan phase, we identify barriers through baseline audits, staff consultation, and workflow assessment. During the do phase, we implemented evidence based interventions, including refresher education on the four movements of hand hygiene, improved accessibility to alcohol based hand rub, visual reminders, and weekly audits and feedback conducted by infection prevention and control
For
staff.
a study
Thank you.
phase, it evaluates whether our intervention successfully improved hand hygiene compliance among personal support workers. Our primary goal is to increase hand hygiene compliance from current organizational benchmark of approximately 94% to at least 97% within 8 weeks, while ensuring that staff participation remains high and hand hygiene supplies are consistently available. To measure success, we will collect both quantitative and qualitative data. The quantitative data will include weekly hand hygiene audit results using standardized observation tools recommended by Public Health Ontario. We will compare compliance rates before and after implementation, monitor alcohol based hand rub consumption, track attendance at education sessions, and review healthcare associated infection rates among residents. For example, if compliance improves from 94% to 97% and respiratory or gastrointestinal outbreaks decrease over time, this would indicate that the intervention has improved patient safety. We will also gather qualitative data through staff surveys, focus groups, and feedback from personal support workers, nurses, infection prevention and control staff, residents, and families. This feedback will help us understand whether the education increased staff confidence, whether hand hygiene products are easily accessible, and whether workload continues to affect compliance. We recognize that several barriers may impact implementation, including heavy workloads, staffing shortages, time pressures, forgetfulness, and resistance to change. To address these challenges, nursing leadership will provide ongoing education, ensure alcohol based hand rub is available at the point of care, recognize staff achievements, and provide immediate, supportive, non punitive feedback during audits. Overall, successful implementation benefits everyone. Residents receive safer care with fewer infections, families gain greater confidence in the quality of care, personal support workers strengthen their knowledge and accountability, and nursing leadership achieves improved quality indicators and a strong culture of patient safety.
For the ACT phase focuses on sustaining the improvements achieved through our hand hygiene initiative over the next 5 years. During year one, we will continue monthly hand hygiene audits and provide quarterly education sessions. Compliance data will be shared during unit meeting to keep staff informed, encourage accountability, and celebrate improvements. During year 2 and 3, hand hygiene education will become a standard part of orientation for all newly hired personnel support workers and will also be included in annual competency reviews. In addition, unit champions will mentor staff, reinforce best practices, and promote ongoing compliance. During year 4 and 5, organizational policies will be reviewed annually using the latest recommendation from Public Health Ontario and the Public Health Agency of Canada. Compliance rates and healthcare associated infection rates will continue to be monitored so that any decline in performance can be identified early and addressed through continuous quality improvement. This sustainability plan is supported by transformational leadership, which encourages collaboration, staff engagement, motivation, and shared accountability. By empowering staff and promoting evidence based practice, leaders help create a positive culture of patient safety and continuous improvement. Our nursing theory is Florence Nightingale's environmental theory, which emphasizes that cleanliness and sanitation are essential to preventing infection and promoting healing. Consistent hand hygiene reflects these principles and supports safe, high quality resident care. To sustain these improvements, the organization must continue investing in ongoing staff education, infection prevention and control support, leadership commitment, adequate supplies of alcohol based hand rub, and personal protective equipment, electronic audit systems, educational resources, and protective time for staff training. Together, these strategies will help maintain high hand hygiene compliance and improve resident safety over the long term. We conclude that improving hand hygiene compliance among personal support workers strengthens patient safety, reduces healthcare associated infection, and support quality care in long-term care settings. By using the Plan Do Study Act model, transformational leadership, and evidence based practice, this initiative provides a sustainable strategy for continuous quality improvement at Mackenzie Health Long Term Care. Thank you for listening.